Hi, I'm Dr. Umang Kothari, consultant plastic surgeon at the Head and Shape Clinic, Mumbai, Malad.
So there's a today's case in a 24 years old boy with a gynecomastia, which is somewhere between grade 2B to 3. He has a very well defined IMC and a very good chunk of glandular tissue. We will take this out, do some liposuction on this side. If you see on the lateral side, he has a good bulge, well defined bulge. So we have to take this out, break the IMC to give the contour. At the same time, now I'm going to do the marking. That's after the liposuction. There's a gland we have removed on one side. That is on the right side. You can see the flatness of the chest on this side. Now, after doing that, I'm removing that gland on the left side. End of 2 hours, we have both the gland, that's left, right, and we have removed from this much, that's around 350 to 1750. There's 1.4 liters of fat. Now I'm closing him up. You can see the contour is more flattened. There's no lateral access on the chest. We have given some infiltration. Now we are going to plan, which is known as minimally pain or a less painful gynecomastia surgery. So that's 5 p.m. and that's today he's going to get discharged. It's immediately 6 hours after the gynecomastia. Can you see the hollowing? This is a small ecchymosis, but this is hollowed. All the fat has been removed. This is been broken now. It's just a soft skin. So it's going to get like this. And that's the pressure garment which he is supposed to wear. This is the most uncomfortable event in the whole surgery, wearing a pressure garment. But this much amount of pressure is important to give the compression.